Hello, welcome to Manchester Memorial Hospital's unofficial tour of the FBC. We are, in these pandemic days, not doing the things we like to do to get you familiar with the floor, so I thought maybe I'd put together a little video to give you some idea of where to come when the main doors aren't open, and what the floor looks like and how things usually happen when we're delivering babies on the FBC, the Family Birthing Center. So this is it. My name is Rob Gildersleeve. I'm one of the OBGYNs at Mansfield OBGYN, and I just thought I'd take this time to show you around and hopefully get you a little bit more familiar with it so it's not as confusing and easy to find when you're thinking about other things like having a baby. So first of all, this is the main entrance. The main entrance is not where you want to go. We have a separate entrance we're going to use for the FBC, which is down this way, this street here, and we'll take a little walk down around the corner and I'll show you a little bit more about that entrance. So now down the street a little bit from the main entrance, we go past to this is Guard Street here, and you can see the signs for emergency and the Family Birthing Center, which are two different entrances. You don't want to go to the emergency entrance unless you're having a real medical emergency like a heart attack or a broken leg or something that needs to be treated like that. For anything pregnancy related, we're going to go to the FBC, the Family Birthing Center. Okay? So again, that's down Guard Street this way, and we'll take a walk down there. So moving down Guard Street, we come to the intersection of Guard and Armory, which is right here at the stop sign. And this little cul-de-sac here is the entrance to the Ambulatory Services Center and the Family Birthing Center, which is upstairs there. This is an important intersection for a couple reasons. One, that's the cul-de-sac to drop off patients and allow them to go through those doors. And then number two is straight ahead through Guard Street here is the parking lot that's most convenient to use for coming and going from the hospital during your stay. Moving over to the door, I'll give you some instructions about how to get in if the hospital is normally shut down and it's after normal operating hours. So up at the door here, there is a sensor and then a camera that will be functional if the doors are locked. And so after hours, the doors are locked and you'll have to call up to the FBC by pushing the button. Somebody on the labor and delivery ward will answer and take a look at you through the camera and then let you come in by unlocking the doors, and then you'll be able to go over to the elevators, and I'll show you that in just a second. Hello?
Hi, can I help you?
Yeah, I just need to come in. We're having a baby.
Sure, can you go ahead and walk to the door and I'll let you in?
Okay, thanks a lot.
Yeah.
Congratulations.
So when you do that, you walk in, the doors will open up for you because they've been unlocked, and you can move in. And then over to the side here are the elevators that you'll be able to take up to the FBC on the second floor. So it turns out you're taking these elevators to the first floor, not the second floor, but it's 2 floors up from where we were downstairs. And then after you get out of the elevators, you make a left, and there you'll see the entrance to the FBC, the Family Birthing Center. You walk up to the door of the Family Birthing Center. To the left here, there's a phone, and the phone will be your entrance in. You have to talk to someone at the nurse's station, and they will let you in by unlocking the door, which will automatically open for you right here. Inside the door, we'll move down the hallway. This is the nursery behind these windows. And then the nurse's station we're coming up to. We'll stop at that second area, just past the hallway, and get checked in. So we'll walk up to the nurse's station and say hello and wait for one of the nurses to be available for us. Maybe Vanessa can help us.
So you'll stop here at the desk, provide us with a little bit of information about yourself, and then a nurse or secretary will walk you to your room.
All right, so we'll go see a room down the hallway. right, here we come.
Down the hall, come on in. This is the typical setup for labor. This is considered a labor and delivery, recovery, and postpartum room, so we do all of that in one place. We have a monitor here to monitor you and your baby during labor. Dad bed over to the side. Big bright windows for natural light.
Yeah, really nice outside today. Beautiful day.
Some equipment over to the side should we need it following delivery. And then hidden over here in the corner is a full bath and shower.
Water tends to be a really nice thing for labors. It's very relaxing, so a lot of women will sit in the shower and just kind of let the contractions go and try and relax and let their bodies do what needs to happen. There's also a tub room, which we'll show you in just a minute. So around the corner is the spa room. So the spa room has a big tub in it, and of course a nice window for great natural light.
Plenty of space in here for you and your spouse, as well as we have some delivery equipment that's missing from the room. Should you choose to deliver here in the tub, we would bring that in so you would have a safe delivery.
And there are some practitioners who are very comfortable delivering in tub and others that aren't, so that'll be somewhat dependent on who's on call for you during that day. Talk more about that with your providers, okay? And now we're going to walk across the hall. Across the hall here are some rooms that we use to sort of determine where people are if they're not certainly in labor or already scheduled for something here on the unit.
You may have a pit stop in here like was mentioned, where we are evaluating you to figure out what exactly is going on.
So a little bit more, a little smaller, more utilitarian room, but just enough to get us comfortably set up for figuring out what's going on and put you in the right place. So real briefly, I'd like to show you guys the operating room, just so you've seen it. At least some of you will probably have a cesarean delivery. If it's not planned that way, well then still some of the deliveries still happen operatively, and so we'll get you just a little familiar with that area as well. So there's a little prep area for physicians and nurses to get cleaned up and ready for the surgeries, and then we have two operating rooms. So they're very sterile, utilitarian places. There's the operating room table, a couple special lights, storage for all the equipment that's necessary to do the cesarean, another what we call a stabulette to check babies out, keep them warm, address any medical issues they may have, but mostly it's just there as backup. Usually what we do is check babies out real quickly and get them back over to mom and the significant other who's sitting right at the head here. When you're on the table, there's a big blue drape that sort of hangs across these two poles. And so this side of that drape up towards the head is where there's a stool for a significant other, and that person will hold the baby right next to mom, and sometimes even on mom's chest after birth, to try and keep them together as much as possible. Almost all cesarean deliveries are done with what we call regional anesthesia, which is either a spinal anesthesia or an epidural, so that we can have mom awake and ready to see her baby and start bonding immediately. So on the way in, we walked past the nursery. This is the nursery on the other side of the glass here. It's the entrance hallway right through the glass there.
Babies don't spend too much time in the nursery. They may pit stop here for a brief period of time for hearing test. There's congenital heart test, some other screens required by the state of Connecticut. But there is a brief period of time that your baby may be here, and this is what it is.
And then the other important room for some babies, hopefully not too many, is the neonatal ICU, called the NICU. And this area is where we can take care of babies that need a little extra attention. There are neonatologists and specially trained nurses that all work here to care for either premature babies or babies who just have special needs after birth.
Should your baby require a stay in our special care nursery or neonatal ICU, this is a spot where we have availability for the parents to spend the night to be closer to their baby. It's a bit small, but we make it work and try to give you the best stay possible. Meals are also provided for you and your partner should you be staying in here.
So again, just a utilitarian room for people is to make it a little bit more convenient to stay close to your baby, which obviously we think is very important. And then back to the nurse's station, and that sort of completes the tour here. And,
So thanks for taking your tour with me today. This is by no means comprehensive, but it is a little something to familiarize yourself with the unit, how things work, and hopefully make you feel a little bit more comfortable when you do come. If you have questions about things, you're welcome to call or talk to your providers in the office. And best of luck with your pregnancy. Hope things go really well for you all and you have a great birth.